Hi, I'm Dr. Shahrul Zuraidi bin Idris, currently working as a consultant cardiologist and internal medicine in Columbia Asia Hospital Klang. Today, I'm going to answer some questions regarding body mass index and obesity. We're going to move on to our first question. What is the most effective way to reduce my BMI? Well, the most effective way to reduce my BMI is by doing a couple of things. First of all, we have to eat healthy diets, especially low carbohydrate diet, low sugar diet, and not more than 12 teaspoons of sugar a day, and also being more physically active. We have to do at least, in average, around about 150 minutes of exercise a week. The next question is, how much higher is the mortality rate for someone who is obese compared to a normal person? Well, studies have shown that people with a higher BMI of between 30 to 35, their lifespan is less than 3 years of average person. And people who have BMI of more than 40 have even less 8 to 10 years of longevity of living compared to normal people. Move on to our next question. How detrimental is being obese to my overall health? People who are obese are at increased risk of many diseases and health conditions, including the following: high blood pressure, high cholesterol, diabetes, especially type 2 diabetes, coronary artery disease, stroke, bone diseases such as osteoarthritis. Obesity can also affect mental health, such as depression, having suicidal thoughts, anxiety, and so on. Move on to our next question. How does my BMI determine if I'm healthy or not? Target BMI or healthier zone should be between 18.5 to 24.9. Less than 18.5 is considered underweight. Between 25 to 29.9 is considered overweight, and above 30 is considered obese. Next question. Does having high BMI means that I definitely have a high cholesterol and high blood pressure? Not necessarily. But of course, the chances of high cholesterol and hypertension, which 4.2% risk in women and 2.6% in men, is higher compared to people with normal BMI. Next question. Is it possible to have a high BMI and still be healthy? Yes, but it's very unlikely. As we have mentioned that earlier, there are very high link of several diseases with a very high BMI. Next question is, only my stomach is big. Is this counted as being obese? Well, we have to understand that obese is based on body mass index calculation, which is weight in kilograms divided by height in meters squared. So it is not just the measure of the size of the stomach, but it's actually the whole total body weight. So definitely big stomach has higher risk of being obese. Next question. Does having high BMI reduces my chances of getting pregnant? Yes, it can cause by disturbing the hormone cycle and changing the sex hormone binding globulin, of course. Next question. If I'm obese and pregnant, will it affect my pregnancy? Yes, definitely can affect pregnancy. It can either affect the mother or even affect the baby. How does it affect a mother? In mother, it can cause gestational diabetes, which means that mothers having developed diabetes during their pregnancy stage, as well as causing preeclampsia or having complications due to high blood pressure during pregnancy. And the mother also can have problems such as obstructive sleep apnea syndrome, which means that they are developing problems of not having enough oxygen when they sleep, and will in turn affect her pregnancy. What about the babies? The babies have been shown, the mother of having higher BMI can have big babies or macrosomia, pregnancy loss, neural tube defect, preterm babies, or even having stillbirth. Next question. Can high BMI be passed down to my children? Yes. There has been recent study linking an obesity gene called KSR2 which is also known as scaffolding gene. And this has been extensively studied and showing that people with high BMI has higher tendency of carrying the gene and then pass it on over to their children. I hope my answers have increased your understanding on the issues of BMI and obesity. That's all for today. Bye.